Well, hello, everybody. I'd like to take a moment to welcome each of you to a webinar from the NIOSH Total Worker Health Program, What is Safety Climate? My name is Dr. Casey Chosewood. For those who I have not had the pleasure of meeting yet, I am the Director of the Office for Total Worker Health here at NIOSH. It is my pleasure to serve as moderator for today's webinar. And on behalf of our program, let me say that we are delighted to have you all with us today. First, a word of thanks for the dedication each of you makes day in and day out to further the safety, health, and well-being of your teams and your coworkers. Each of you really are the reason that we are here, and we're indebted to you for your service on behalf of the nation's workers. The Total Worker Health team, as part of this webinar effort and all of the things we do, really pledges to give you the latest data, the best research, the most compelling guidance, and the competencies that you need so you can grow your own skills as occupational safety and health professionals. We will track the latest challenges that are facing workers, rapidly changing work conditions and work policies, the best and most promising worker and organizational level interventions, all with an eye to making work better, safer, healthier, and more meaningful, both to you and to those people that you serve. Yes, obviously, work should be a paycheck, but it should also pay off in so many other ways as well. And I think together we are poised to broaden the possibilities that lie at that frontier of high quality work and a long, productive, fulfilling life. So I'm glad you're here with us today. In many ways, today's webinar topic takes us back to our roots. There is no total worker health approach if we do not first keep workers safe. And our focus today on safety climate is certainly timely, it's fitting, and it's more important than ever. So with that, a sincere and a warm welcome. Now a few words on continuing education. As part of our webinar series, we've given thousands of hours of continuing education over the past several years, and we want you to take advantage of this as well. You can see the CE available to almost all occupational safety and health professionals, pharmacists, nurses, physicians, industrial hygienists, certified safety professionals. Please take advantage of this free opportunity. Detailed instructions on accessing the Training and Continuing Education Office at CDC site are available for download at the website at the top of your screen. Note that the bright blue activity number is only for those watching the live webinar. You will need the course access code, which is Safety Climate, to receive credit. The gray activity number is to be only used for those who are viewing the recording or attempt to access CEUs after May 20th, 2022. We are recording this webinar and plan to post it on the Total Worker Health webinar page as soon as possible for those who can't join us today. So now let's get started. As I mentioned before, I'll serve as your moderator today, and I'm excited to introduce you to our two great speakers. Our featured presenters are Dr. Emily Huang and Liz Hill. Dr. Huang is an associate professor with the Oregon Institute of Occupational Health Sciences at Oregon Health and Science University. During her more than 20 years as an occupational safety and health researcher and consultant, she's published over 90 peer-reviewed journal articles, 6 book chapters, and more than 100 worldwide conference proceedings and presentations. She's provided recommendations to numerous occupational safety and health practitioners. She's a fellow of the American Psychological Association and a member of the Society for Industrial Organizational Psychology, or SIOP. Dr. Huang has successfully supervised safety climate research teams for over a decade and has been named the most prolific contributor to this research over the past 38 years in a published independent analysis. We're so happy to welcome Dr. Huang today. After she speaks, we'll be joined by Liz Hill. Liz is a total worker health advisor for the SAIF Corporation. Liz has more than 25 years of experience in professional health and safety, and even including a short stint in international health work as well. Prior to joining SAIF, Liz worked in a variety of industries from oil and gas to higher education. She has a BS in industrial hygiene and a master's in public health. She's also designated as a certified industrial hygienist and a certified safety professional. She currently serves as vice chair of the American Industrial Hygiene Association's Total Exposure Health, Total Worker Health Advisory Group, and is a past chair of the AIHA Safety Committee. So with that, I'm ready to turn the microphone over to our first presenter. Welcome, Dr. Huang. It's a pleasure to have you with us today.
Thank you for your introduction, Cassie. Hi, everyone. I'm Emily Huang. I'm an associate professor at OHSU. I'm delighted to be here today and have the opportunity to share our work with you. The title of this webinar is What is Safety Climate? Definition and Practical Applications. Thank you for joining us. We have a safety climate lab at OHSU. The mission of our lab is to help organizations build good workplace safety, workplace culture and climate. We conduct scientific research in organizational culture and climate, but also provide consulting services to companies. Here is the link to our lab website if you are interested. And you can also find our lab website information if you Google safety climate at OHSU. We all know that occupational injury is still a great concern in the workplace. In 2020, just in the US private industry, there were 2.7 million non-fatal workplace injury illness, 2.2 cases per every 100 full-time workers, still nearly 5,000 fatal workplace injuries. According to the Liberty Mutual 2021 Workplace Safety Index, the total cost of the most disabling workplace injury in the US is nearly $60 billion a year, over $1 billion a week. And we all know it is not just about money. It is about people's life, their quality of life, and the impact on people's family as well. These slides present results of analysis reports on the causes of several major workplace disasters. As you can see, the report identified poor safety cultures as a key contributing factor for these major disasters. So what is safety culture and what is safety climate? I saw questions in Q&A, so here's the answer. Safety culture and safety climate are similar, but somewhat different construct or somewhat different factors. Safety cultures is usually defined as companies' underlying belief and core value within an organization's structure and control systems that produce behavior norms. So these concepts of underlying belief, core values, and behavior norms are very conceptual and subjective, right? It is important for a company to have the core value on safety or total worker health. But again, how to measure it is pretty difficult. It's very conceptual, very subjective. How can we give a score about company's underlying belief or core value? So it is not easy to measure safety culture directly. Therefore, safety climate can be seen as an indicator and a measurable aspect of safety cultures. So we use safety climate as a snapshot to measure the safety culture of the companies. And it is important to help companies to build good safety cultures. But the concept is very difficult to measure directly. So we define safety climate as a factors, as a take a snapshot, as indicators to measure the safety culture of the companies. Safety climate was first introduced by Professor Zohar back in 1980. Safety climate is usually defined as employees' shared perception of their company's safety policies, procedures, and practices. It is seen through employees' eyes, so the information is usually collected through employee surveys. And this provides a snapshot, one moment in time, to indicate safety culture of the companies, as I just shared with you in the previous slide. And the safety climate is about the overall importance and true or relative priority of safety at work. We know that many companies put up big signs that safety is number one, but when schedules are behind, then safety is no longer number one. So again, safety climate is about the true priorities of safety at work, as seen by employees, and not just about what you do. It's not about what you say, it's about what you do. And then it's probably not a surprise to you, the number one dimension of safety climate or safety cultures is the management commitment to safety and prioritizing safety over competing demands across range of situations. Again, when the schedule is behind, when there's the money issues, when the schedules, productivities, safety is still important when there's a competing demands. And again, it's not just about what you say, it's about what you do. And leaders create the cultural climate for their companies. Safety climate research has grown a lot in the past 40 years. And why? Because safety climate has been identified as one of the best leading indicator, a robust predictors of future injuries. Many studies, hundreds of studies have shown that a safety climate is one of the best leading indicator for future injuries, and accidents and injuries are considered lagging indicators. So many companies, they do accidents analysis, which is quite important, and try to understand the reasons why the accidents and injury happen. However, sometimes when disaster happen, it's already too late. And companies shouldn't have to wait until accidents happen or injury happen to know their place is not safe. Company can use leading indicators, again, a robust predictor, leading indicators such as safety climate to measure their safety status now. In this analysis, is a meta-analysis in the studies, combining data from hundreds of safety climate studies. Again, there are 14 years of research now, has shown that when a company have good safety climate, their employees have better safety knowledge and have higher level of safety motivations, which leads to better safety behaviors and safety performance, and eventually have a fewer accidents and injuries. Again, it is important for company to have good culture and climate, and the safety climate surveys and safety climate score can be used as leading indicators for future injuries. Now, I am very honored to have had Professor Zohar from Israel, who is the father of safety climate research and published the first articles back in 1980s as a visiting scholar on my research team since 2009. As I just shared with you, there are many scientific articles focusing on safety climate research. Most have focused on traditional work environments in which supervisors and workers interact under the same roof throughout the day. So for these particular projects from our research team, we wanted to extend safety climate research to the population of mobile remote lone workers. When employees work alone and no one is around, no one is watching, do they still form safety climate perception of their companies? And when the company have a good culture, good safety climate, do these perceptions have an impact on their employees' behavior and the safety outcomes, even when no one is watching. So specifically, we developed 2 safety climate surveys, one for the trucking industry and one for the utility electric industry. So in these projects, we also tested the validity of a generic short safety climate scales, the short scales for lone workers, for lone remote workers, which we adapted from Professor Zohar's prior published scale. Survey research is a science. We all know that simply writing questions on papers is not the same thing as designing a scientific valid survey. In our study, we have combined both quantitative and qualitative methods. We also call it a mixed methods approach in developing these scales. We also follow best scientific practices in testing the reliability and validity of the scale. So reliability is about the consistency and stability, and validity is about accuracies. Our team has spent a great deal of time and effort to make sure the scale we developed are reliable and valid. Again, companies spend time and effort. It is important for them to choose a scales, again, which have good evidence about it's reliable and it is valid, really measure the construct, the target constructs we care about. And the score can really be used as a good indicator for important factors we focus on. Here is the breakdown of the data we collected from the trucking companies. Altogether, we have collected data from 8 large trucking companies in the US, resulting in over 8,000 drivers and 1,000 supervisors in our final sample, all with good response rate. As I just shared with you, our team has spent much time and effort in providing evidence of the reliability and validity of the scale. It is very unique that we were able to collect objective safety outcomes 6 months after the survey and link those safety outcomes to the individual driver's safety, the survey score, the safety climate score. It is the strength of our study. This is the trucking safety climate surveys our team developed, validated, and published in a scientific journal. So we have 20 questions to measure the company level safety climate. Those are about the overall upper management, the top leader of the companies. They are focused more on the policies and procedures to develop a good policies for companies. So it is a company level safety climate. And we have 20 questions to measure the group level safety climates. Those about, it's a different set of questions. And this is about the supervisor levels, or we call it local cultures, the local culture and local climate of the companies. So again, for these trucking safety climate surveys, we developed with Professor Zohar, have total 40 questions, 20 questions to measure the overall company level safety culture and climate, and then 20 items to measure the local, the group level culture and climate. And this is an industry specific scale, specific for drivers, truck drivers, as one type of lone worker. From these tables, you can see that although both the industry specific scales and a short generic scales we also develop in these projects show significant predictions of future safety performance. The industry specific scales offer stronger predictions. So when industry specific scales were used, there was an incremental variance of 11% from 10% to 21% for the group level safety climate, and the increase of 6% of the prediction of safety performance for the organizational level safety climate about 14% to 20%. So in this study, we also present an evidence. The industry-specific scale, as I share with you, have total of 20 questions for company level, 20 questions for supervisor levels. We also develop and validate a short generic scales. And company can use 6 questions to measure the lone workers' safety climate for the overall company level and 6 items for the group levels. And this study, these results show that both scales work. Both scales are reliable and valid. But the industry's specific scales provide stronger predictions and explain variance. That's how we call in the factors, in the target factors we focus on. So in this case, the companies, they can decide to use the regular trucking lone worker scales to provide more detailed information, and where's the opportunity for improvement, for examples. But for a company, if they just say, we are doing employee opinion survey every year, we like to add a few more questions. Can we have a short scales? We do offer short scales based on the original scales. And again, both scale will work. So this makes the scale be more flexible and versatile. So these are the final outcome of our lone worker projects. First, we developed and validated 3 safety climate scales, 1 for the trucking industries and 1 for the utility electrical industries, and 1 generic scales for lone workers, for lone remote workers. Second, our results show that lone workers who work alone by themselves for majority of time, they do form safety climate perceptions. And these perceptions can effectively predict important safety outcomes. So again, even when no one is watching, when no one is around, when a company have a good safety culture and climate, again, leaders from multiple levels, from top management all the way to frontline supervisors, when the company have a good culture and climate, even when their drivers work alone, their workers work alone, no one is monitoring, they do behave safer, which leading to less accidents as well. Finally, our results also show that safety climate can be measured with a generic short scales and or the long industry specific scales. And generic scales allow comparison between different companies and different industries and relative benchmark. Right? There's some company, they choose to use the short generic scales every year, so they can use it as a yardstick to see whether their score change over year. And then, or some of the intervention programs, they can utilize the safety climate score before and after intervention to see what is the impact of their intervention and really improve the safety culture and climate for their companies. And the industry specific scales improve the prediction of the safety outcomes of the target important outcomes and other important safety outcomes such as objective injury rate. And the longer the scales, the industry specific scales also provide more insights that will share with you the information, what are your strengths and where's the weaknesses or the room for improvement for your company. So in another study, we extend the safety climate literature and examine the impact of safety climate on non-safety outcomes. We know when a company has good safety culture and climate, they have better safety outcomes. And in these studies, our results show that safety climate, show the impact of safety climate is extend beyond safety outcomes. So our studies show safety climate can predict employees' job satisfaction, employee engagement, and also objective turnover rate, even 1 year after the survey collection. Again, these studies show the impact of safety climate extends beyond typical safety outcomes to employees' life, the impact on employees' life and organizational outcomes. So similar to the lone worker projects, in order to make the safety climate scale more flexible and versatile, so our team published studies utilizing items response theory to shorten the original widely used Zohar scales. So Professor Zohar had published the scales, which include 16 items to measure company level safety climate and 16 items to measure the local culture and climate. So we apply item response theories and we shorten these scales. So now any companies can now use our 4 item scales to measure their company's overall safety climate and use 4 items to measure their local cultures, their supervisor or group level safety culture and climate. Recently, our team published 2 articles summarizing 40 years of research on safety culture and safety climate interventions, and 16 strategies in the scientific literature has been examined to help companies to improve safety culture and climate. So I have provided citations for all the papers, all these papers published by our lab, such as like these 2 papers is published by Li and Huang et al. 2019, Journal of Occupational Health Psychology, and 2021 we have another papers, Journal of Safety Research, again discussing and presenting those 16 safety culture and climate interventions, summarizing 40 years of research. So you're welcome to actually we provide citations for all this paper, and most of the paper can be available. Most of them are available directly on our lab website on the link I shared with you earlier. And we have an open link, so you're welcome to download them directly from our website. And you're also welcome to contact me if you're interested and if you are not able to allocate any particular articles I just shared with you. So our team is currently engaging with the following funded research projects: developing and validating of a total worker health climate scale, a scale to measure organizations' culture and climate for safety, physical health, and well-being. It is a project funded by NIOSH, thank you, through the Total Worker Health Center, the Oregon Healthy Workforce Center. So in this project, we like to extend the safety climate research to develop this total worker health climate scale. So this scale will include 3 subdimensions, including climate for safety, climate for physical health, and climate for well-being. So the climate for safety, as I just shared with you, there are 40 years of research. We will use existing scales, which Professor Zohar and I published for the climate for safety. And we will develop a subdimensions, subclimate on climate for physical health, include important components such as sleep, diet, exercise. Again, create a culture where a company care about employees' physical health as one of components. And another subdimension is climate for well-being. And that would include important dimensions such as mental health, mental health, psychological health, emotion, social health, and overall well-being. So our goal is to develop and validate the total worker health climate scales as a leading indicator, as an important indicator of important total worker health outcomes. Again, the outcome will include both safety, physical health, and mental health well-being. Another project we are currently working on is to develop and validate a respectful workplace climate scales for the construction industry. It is a project funded through Oregon Department of Transportation and the Bureau of Labor Industries. So in these scales, again, the goal is to help company build a respectful workplace. And the important sub-climate and dimension will include the company have a good culture of including DEI, diversity, equality, and inclusions, free from harassment, discriminations, build the trust, the organizational justice in the companies, and also workplace civility, the behaviors, the appropriate behaviors, language to use in the company. Again, with our lab extending from the 40-year safety climate research, and we appreciate the opportunities to continue applying science and research in developing those additional scale, extending to total worker health climate scale, and also the respectful workplace climate scale. And we look forward to develop and validate the scales and share with the community shortly. So regarding our consulting projects, so last year, our team has worked with the United Nations System Staff College to implement our lone worker safety climate survey, the one the project I just shared with you, as a measure to validate their interventions. So their team offer intervention to their drivers, and then they utilize our scales before and after their interventions as a way to measure the impact of their own interventions. So our surveys were implemented with drivers in Uganda and Ethiopia, and our team has collected the survey data, analyzed the results, and provide feedback workshops with the managers in these two countries. And we appreciate they see the values, again, utilizing the safety climate survey as an indicator, as important outcomes that they like to target on, and then examine to see whether their interventions really make impact. Recently, we completed a project delivering our safety climate surveys to workers in over 100 construction companies and subcontractors, and provide feedback workshop to the management team in these 100 companies in two countries, actually in the US and Singapore. And we also have a podcast about our work in the construction industry. You're welcome to listen to it if you are interested. I provide the link here. And then also this year, we conclude a 2-year project with SAIF Insurance to develop a safety cultural assessment tool, which SAIF can utilize with their policyholders. I would like to conclude my section by saying safety climate can be monitored and measured, and hence improved. What gets measured gets managed. So now I would like to turn it over to Liz from SAIF Insurance to share with you our joint work in developing and validating the NSPRO safety cultural assessment. These will also discuss SAIF's effort in total worker health. Thank you.
Thank you, Emily, and thank you, Casey, and the Office of Total Worker Health. We're very excited to be here and talk a little bit about our collaboration that we had with Emily's lab. So for a little perspective, SAIF is the Oregon's not-for-profit workers' compensation insurance company. We have a vision to make Oregon the safest and healthiest place to work. For an example of the influence we have in the workplace here in Oregon, we insure over 50,000 policyholders, and that accounts for about 700,000 workers in the state of Oregon. So you can see as we work with our policyholders, we do have a great deal of influence here in the workplace in Oregon. SAIF is also a Total Worker Health affiliate. We practice total worker health internally for our employees and externally with our policyholders, and I'll talk more about that a little bit later. We became an affiliate in 2016 and have just recently done our 3rd renewal. And we also are a part of the Oregon Total Worker Health Alliance, which was started in 2017 along with the Oregon Healthy Workforce Center and Oregon OHSU. We are one of the, I think we are the only alliance in the country where those three major players, a Center of Excellence in Total Worker Health, a workers' compensation provider, and Oregon OHSU, our regulators, work together to further total worker health in the state. So with that background, I'd like to talk about how we work. So we work as a consultant model. So we have consultants that work directly with our policyholders, both large and small, across all industries possible. And two of the main strategies we use with our policyholders is the Ansbro Safety Culture Spectrum and Total Worker Health. So our consultants are educated and skilled at working with both of these topics with our policyholders, and we really believe that using these in conjunction with our deep safety and health knowledge that we have in our consultant core will really get to that Oregon being the safest and healthiest place to work. And as Emily mentioned, safety culture is highly predictive of outcomes in terms of injury and illness. And that's why many years ago, one of our great consultants started thinking about how do we talk about safety culture with our policyholders. And this was Trevor Ansbro. He has since passed away. And so we call our safety culture spectrum that he developed the Ansbro Safety Culture Spectrum. You can see as he developed it, we had 6 dimensions that we really wanted our policyholders to take a look at in terms of where is their safety culture. And within those dimensions, there were 4 levels from reactive to comprehensive. So we knew this was a great idea. What we didn't necessarily have is the evidence behind it that this is going to be, as we talk with our policyholders, as we ask them to assess where they are on the spectrum, as we get them to think about how could they advance to higher levels, we didn't have the evidence to say it was telling us what we thought it was telling us. And also when we asked them the questions, that we were getting the answers that really told us where they were and what they needed to work on. So we were thrilled when Emily joined OHSU and we were able to start a project with her lab. And we were really asking them to help us validate our safety culture spectrum that Trevor had developed. So in that validation project, there were a few elements that we at SAIF just did not have the skill set or knowledge to necessarily do effectively. So Emily's team did a literature review, started working on justification for the elements that we had. They did multiple subject matter expert and policyholder interviews to verify that the spectrum language makes sense and is accessible. In other words, is the language such that our very diverse policyholders could take a look at that, read it, understand it, and then make sense of it for themselves. The result of that was they were over 70 adjustments or added elements that were done to reflect evidence and the interviews that were conducted. And just for one example, you saw earlier that one of our dimensions was leadership. And we adjusted that language to leadership and competing demands, and Emily made some really great justification for that in her presentation. The other piece of that was that we had a survey and we wanted that survey to be validated. So again, we could say, yep, we're asking you the right questions. Your answers are telling us what we think it's telling us. And so they undertook a survey validation for us. This took a while and there were many iterations, and you know, it was really a very profound experience for many of us that were part of this project. The survey was validated. I will say that it was validated and we changed some questions, and as we adjusted the spectrum, we took a look at what we were asking. So now it has been developed and it aligns, reflects, and represents the Ansbro Safety Culture Spectrum. I will also say, also as Emily talked a little bit about shortening the surveys that she had done in the past. It reduced our 30-question survey to 10 questions. And this is really important for our policyholders, that they can take a 10-question quiz or have their employees look at that 10-question survey versus a 30-question survey, both in terms of the time that it takes, but also really engaging, you know, and not losing that interest or over surveying people. So we're really thrilled with that outcome as well. These are the new and adjusted dimensions. We have safety, leadership, and competing demands, accountability, employee involvement and communication, risk and systems assessments, programs, procedures, policies, and training, equipment, environment, and budget. And within each of those dimensions, these are the levels that we adjusted. Reactive, and a little bit, this language, informal program, focus on OSHA rules, that language was added to be a little more explanatory as our policyholders look at the spectrum, and also our consultants, which I'll get to in a little bit. So here are our 4 adjusted levels. The original purpose of the development of the safety culture spectrum for SAIF was to help organizations move from a reactive mode to comprehensive. And our approach was to meet them where they are at and partner with them to help them move to the next level. So this validation project that we did with Emily's lab really helped us have that evidence behind what we were doing and what we were talking with them about and what we were recommending that they do, and really the value of assessing your culture and that predictive value of it as well. So you can see when we discuss this now, we talk about this compliance focus to a data focus, and then as you move on up the levels, more to the culture focus. Just going to take a quick look here at leadership and competing demands. And again, as we feel like this is probably the one that we start with our policyholders. We understand the importance of it. And again, Emily articulated very well how key leadership is in your safety culture. So this is what consultants, I'm going to give you a little bit of the consultant script that was developed that consultants use to talk with the policyholders. So they say things like, let's start with safety leadership. We're going to break down safety leadership and look at it from each culture level. Based on this overview, you get to look at each level and decide or think about where you might fit right now. And then we're going to move on and do that for all of those 6 categories. Then they start a conversation and say, where do you want to be? You know, do you want to move up levels? And we have things that can help you get there. I want to point out here in the leadership and competing demands dimension, where the managed and comprehensive levels in particular are the ones we feel are the closest to total worker health policies, programs, and practices. So if we have policyholders operating in managed and comprehensive on the leadership dimension, we feel like they are really getting to that total worker health approach that we are also encouraging our policyholders to engage with. This is how we're using it. We're using the survey that Emily's lab developed and validated for us as an assessment tool, both to, as I previously mentioned, to assess where they are and where they want to be. It's also a way of measuring progress. So as we work with our policyholders, we can show, and we know how important it is to have even small successes. So as we show the progress along the different levels in each dimension, they can really feel good and feel like they are effective at making change in their organizations that they wanted to be. In addition, we had a team that spent a lot of time developing consultant tools, a consultant workflow, and really a lot of supportive documents. Policyholders are provided then from their consultant 3 emails. They have an introduction, an invitation, and a reminder for examples of how they can communicate the survey with their employees. And also then we provide them a link so that they can build the survey how they need to, and they can customize and use the emails that we provide, or they can do all of that all together. So there's really a process that consultants follow with the policyholders and really are with them every step of the way. Some of the things that they spend time talking about with the policyholders is how a strong safety culture can benefit their organization, talking about the benefits of morale and productivity increases, and then also what Emily also touched on, creating a more desirable workplace to attract and maintain employees. This is our internal portal for all the consultant tools, and you can see consultants have just a wealth of things that they can choose from to engage with policyholders, including the survey request form where they can set up the SurveyMonkey and other survey tools specifically for the policyholder that they're working with. In addition, we've developed what we call the Leadership Series. And this is a series of resources that we call cafeteria style. So policyholders and consultants can take a look at all the resources that are built around leadership and decide which the policyholders really need to focus on at any given time. They are really designed to work hand in hand with the spectrum and the work that we're doing with safety culture, and designed also to help our policyholders move through those levels at the spectrum. So there, again, we have for each spectrum aspect, resources, training tools, and I will note that total worker health principles are woven throughout. It may not be called out by name, but we really were very thoughtful about how we interweave total worker health into all the resources that we develop at SAIF. And then finally, the future. We're excited to be involved in Emily's work on Total Worker Health Climate Survey. There is, for example, I am one of the subject matter experts as part of that project. And we're really taking a look at this as a future tool we might use very similar to how we're using our safety culture spectrum currently to look at what's beyond that managed and comprehensive level on the safety culture spectrum. And really thinking about, will we be able to use this and incorporate it as a policyholder total worker health or well-being approach assessment, and again, use it to build some resources to help folks really advance in their total worker health journeys. And with that, I just really like to thank NIOSH for this opportunity to talk about what we're doing here at SAIF, Emily and her team for all the wonderful work on the validation project, and finally the internal SAIF team who has done many years and many hours of time and energy in developing the spectrum and developing our consultant tools and resources. And I just want to acknowledge a couple of people specifically, Angie Wisher and Shelley Nasby, who helped me get all the details right and have really been involved with the spectrum from the beginning. With that, thank you, and I'm going to hand it back to you, Casey.
Thank you so much, Liz, and thank you, Emily. You both just were exceptional today. We're really, really appreciative. We do have about 10 minutes left to our webinar hour today together. And in addition to the Q&A that we already have in the chat, there probably is time for a couple of more questions to be added. So if you do have just an urgent question you would like our presenters to address, please go ahead and enter it into the Q&A chat. Also, if you take a look at the Q&A box, there's some questions that have already been answered. So feel free to click over to the answered questions button to see the responses that have already come in. One that struck me, Liz, that you probably haven't had a chance to get to yet, which is certainly this related to quite a few questions that have come in, is this difference really between culture and climate. And Emily's done a great job of setting the stage for, you know, the value of both and the implications and their relationships to each other. But it looks like SAIF has chosen really to concentrate more on culture in their products over climate. Any reasoning behind that? Obviously, the two are quite connected.
Yeah, I would say the two are quite connected. And as I think about it, and as I listened to Emily, I was like, oh, I had really not thought of it that way before. And it really elucidated some ideas for me too. I think we use safety culture because it is the term that I think most people connect with. And again, we're trying to meet our policyholders where they are at. But as I thought about it, I'm looking at our survey and thinking, yeah, but our survey is really getting at that safety climate piece of it too, because that's what we're trying to measure. So I don't see necessarily, just because we don't use the word safety climate, that we're not involved. And Emily, feel free to jump in and correct me there, but that is what I started thinking. Oh, we are doing safety climate. We're not necessarily calling it that, but that's how what we're using to see where our policyholders are at on the safety culture.
Yeah, thank you. I also like to tap in the safety culture and safety climate. Yeah, in scientific research, we do try to differentiate and try to understand the differences. There's one question about how to measure the existing measure for safety cultures. Again, safety culture is a concept, very conceptual, very subjective. So there's a lot of tools and take a lot of time to really measure the cultures. Such as you may need to join the company 6 months, observe, look at the policy, actual policy procedures. It is hard to have a standardized score about companies' core values or underlying belief or behavior. So safety climate, just one indicators, one standardized indicator. You can just implement surveys at one point in time, collect the data, you know your score. But in order to really understand the true cultures of the company, it takes a lot of effort, definitely not just one surveys. And it is hard to standardize comparing company A and B, what is their cultural score, if they are in different industries, totally different in terms of core values and the norm. And I would say, since working with Professor Zohar back in 2009, actually when we communicate with company, when we provide feedback workshop, he will use the term safety cultures. We are providing your score for safety cultures. That's how the policyholder, the companies, the management team, they have that concept. So as a researchers, we do know we are sharing with you a safety climate score. The score can be used as an indicator, a standardized score for your safety cultures. But for both Dove and I, we don't have any problems for companies in order to encourage company to interest about their cultures, to really care about safety or total worker health, and to set it as a core values. We have no problem at all for company to say, we are coming to help you measure your safety cultures. We'll give you a score, even though we call it safety climate score, that is an indicator of your safety cultures. So that's the research and the reality. And the key purpose here will be encourage companies based on their knowledge, what they understand about safety cultures, interested to get a score. And there's one question about how to utilize the safety climate score, like both from the tool which Liz provide and also several projects we developed. I'd like to mention the safety climate score has been utilized in multiple ways. So any companies, again, they can have a score, implement the surveys to understand and to measure their current status. So the scales is about 1 to 5. The standard safety climate score is 1 to 5. If any company, they have a score such as below 2, which really indicate they are in the critical state, they should do something right away. Again, don't wait until accident happen to know your place is not safe. And again, from so many companies we work with, like we will encourage company to have a score above 4.5. That means excellent. Most of company, they will get a score between 3 to 4 or 3 to 4.5. Those are the typical companies in terms of range in their safety climate score. Again, below 2 or even below 3, they should consider implement something and make change. Don't wait until disaster happens. For a company to say they are really good and excellent, they are excellent, they have great safety cultures, they have excellent score, we will encourage companies to target on 4.5 and above, so that can be utilized as a standardized scales. And also, of course, the climate score can be used as a yardstick, as I share with you. You're welcome to attach those 4 questions we developed to the employee opinion survey. So you're able to keep track of your safety status every year. Use it to see anything change, right? During this difficult time, pandemic, are anything change in terms of our safety culture and climate? And when a company implement interventions, similar to the United Nations project we work with, they do offer particular interventions. So this safety climate survey and the score can be used like pre and post any strategy, activities, or intervention to see those intervention really make impact. So they increase, for example, from their score to 3 to 3.5. After the statistic analysis, you will see there are significant increase, have made a positive impact on companies' safety climate. Again, an indicator of the culture of the company. Yeah.
Great. Thank you, Emily. I saw a few logistical questions. Yes, this presentation is being recorded. It will be archived to the Total Worker Health webinar page. The slides are available. If you have a specific technical question that we can direct either to Emily or Liz, you can always send any inquiry about this or any other matter related to Total Worker Health to twh@cdc.gov. Once again, that's twh@cdc.gov. We have just a couple of minutes left. I'm going to ask each of our presenters if they have any final remarks to share in relationship to a question or just in general. And before we go, I'll just say thanks to both of them. But Liz, any final remarks before we wrap up today?
You know, I think that for us, this was a very valuable experience. And like I said, we had seen the value of safety culture previous to our involvement in this validation project, but it really solidified both our commitment to using it as a potential tool to further our vision as a work comp insurance company, but also, you know, because we have this really vested interest in making Oregon safer and healthier. It's just a great tool for visualization for our policyholders as well, to think about how we can do this and do it in a practical manner, and brought it down from theoretical to something that is really applicable to them in their organization and where they are.
Thank you, Liz. I'll ask Sarah to go ahead and move us to the next slide so folks can have a moment to see how they can connect with us. Once again, our email address is twh@cdc.gov. Dr. Huang, thanks so much for joining with us. Any final comments?
I just want to mention the mission for our team is to helping organizations build a good workplace culture and climate. We appreciate have the opportunity to extend our safety climate research to total worker health, climate, and also with the goal to help company build a respectful workplace. So we really appreciate have the opportunities to join this webinar today, and also looking for opportunity to share the skills we develop and the research product results our team work on to share with the community in the near future. Yeah. Thank you.
Great. So there you heard it, folks. Both of our presenters are very open to working with you and providing you with their own tools and resources. So feel free to reach out. And with that, we are out of time today. Again, a big thank you to our presenters and to everyone who joined us today. Kiana and Sarah working behind the scenes, you're both just exceptional. We invite all of you in our audience to stay connected with us through our website and our social media channels. Certainly, if you're not a subscriber to Total Worker Health in Action, our quarterly newsletter, please sign up today, and we'll make sure you stay up to date on the latest news in the world of total worker health. Once again, we're here for you, so please let us know how we can help. Have a great day, and let's together make sure that total worker health is at the top of our list when it comes to worker safety, health, and well-being. Have a great day, folks.